Hey guys, this is Dr. Sean again from Hilton Physical Therapy. I promised you guys this week that we would be talking about upper cross syndrome, or sometimes coined text neck. That's what we're going to do today. So with upper cross syndrome, this is something that we typically see in people who have more sedentary jobs, people who typically spend a lot of time on the computer, or also people who spend a lot of time on their cell phone where they're looking down constantly. So what happens with this is that normally we have a nice healthy curvature in our spine where we've got usually a lumbar curve that kind of curves inward, okay? So we see a nice concavity here usually, and then the thoracic spine where it curves out like this, where we call that a convexity, where there's a thoracic or a kyphotic curvature, and then again in the neck it curves inward again. We call that lordotic curvature. And that's a nice healthy S-shaped curve that we need to have in our spine. But what happens is with that sedentary posture where you're constantly looking down or looking forward, the curvature starts to flatten out, where there's a diminished lordosis curve in the cervical spine and a flattening of the thoracic spine, which isn't good. We need that nice healthy curvature in our spine in order to dissipate stresses in our spine. And if that curve flattens out, what happens is our spine is no longer to dissipate those stresses, so they start getting absorbed in our spine, and we can get early onset degeneration or thinning of the disc, which causes some pain. Another thing we see in this upper cross syndrome, I'm going to show you this picture, is typically these people, they have really tight pectoralis muscles, so their chest gets really tight, and that causes rounding of the shoulders, okay? Another thing we see is that the upper traps and levator scapula muscles get really tight, and what that causes is shrugging of the shoulders, excessive elevation of the shoulder blades. So you got this rounding posture and the shrugging of the shoulders. Also what we see on the other end, so if you're looking at the other line of this X, is we see people with weak neck muscles, weak neck cervical stabilizers, and weak scapular stabilizers. So what that means is the muscles that we use to stabilize our spine and support our cervical spine become weak, and they are unable to effectively support our neck, so we start getting neck pain. And also the muscles in the back of our shoulders, between our shoulder blades, they also become weak, and then that can make you more susceptible to things like shoulder pain, difficulty with elevating that arm, okay? So what we're going to do today is I'm going to show you 5 exercises that will help to resolve that issue and to help to prevent it against that from ever happening. So the first exercise I'm going to show you is called cervical retractions. So with this, you want to try to maintain a nice upright posture, sitting up nice and tall. And you also want to make sure you're looking forward, okay? So I don't want you looking up, not looking down. And all you're going to do is you're going to pull that neck back, okay? You're going to hold that for about 5 or 10 seconds, and then nice and relax, okay? And you may feel an inclination to pull back your shoulder blades also while you're doing that, and that's good. I want you to do that. So you're going to pull back that neck and pull back those shoulder blades and hold that for 5 or 10 seconds, and then relax. Now, what some of my patients like to do is they'll pull back their neck, pull back their shoulders, and they do that great, but then they come back forward again like that. Now, I want you to still maintain that nice upright posture, okay? I'm going to show you from the side view here. So, again, you're just pulling back your neck, looking straight ahead, and pulling back those shoulder blades, okay? And what this exercise does, it helps to strengthen those cervical stabilizers, those deep neck flexors in the front of our neck that help to support our spine, okay? So the next exercise I'm going to show you is going to help with strengthening back those scapular stabilizers, so the lower traps, the middle traps, and those rhomboids. So what you're going to do is just pull back your arms like this, okay? And then hold that for about 5 or 10 seconds and relax. Okay, and you want to maintain a nice upright posture. Really think about almost as if you have a puppet string attached to the top of your head and it's pulling you up. So you're pulling back those arms, squeezing back those shoulder blades, Hold that for 5 to 10 seconds, and then relax. And when you're relaxing, you're not going like this, right? You're still maintaining that upright posture. So again, with both those exercises I just showed you, you would do about 10 reps and hold each one for about 5 or 10 seconds. So the next exercise I'm going to show you is a stretch, to stretch out those tight pec muscles that we get from that upper cross syndrome. So I'm going to come over to the corner of the wall here. I'm going to move my phone so you can see me. Okay, so what we're going to do is you come up to the wall corner, you put your hands firmly against the wall, your hands and your forearms. You have one foot in front of the other, okay, kind of staggered, and you lean forward to stretch those muscles. And it should be a mild to moderate stretch, not an intense stretch. So with this, you can, when you're doing the stretch, you can keep your arms your hands kind of level with your ears. And then you can also move your arms up a little bit higher and do the same thing. And that way you're going to be stretching different fibers of those pec muscles. And again, you want to keep your feet staggered, so you have one foot in front of the other. It doesn't matter which foot you have in front. You want a mild to moderate stretch, and you would hold that stretch for about 10 to 30 seconds, and you can do 3 sets of that. And you should be feeling the stretch right here. You shouldn't be getting shoulder pain. If you're getting shoulder pain, just scratch it. Don't do that exercise. We don't want any pain with that. It should just be a nice, comfortable stretch in your chest area. The next exercise I'm going to show you is to strengthen what's called our serratus anterior muscle. Okay, so that's a muscle that's on the underside of our scapula. And the job of that muscle is to keep our scapula firmly pressed against our rib cage. Now, with this upper cross syndrome, that muscle has been shown to significantly weaken, and what happens with that is people tend to get winging of their shoulder blades, where that medial border, or that border of your scapula, starts lifting up and is no longer firmly pressed against your rib cage, and that can cause some problems with your shoulder elevating, so difficulty with raising your arm up. So I'm going to show you an exercise to help to strengthen back that muscle. So what you're going to do is you're going to get on all fours, on your hands and knees. It's called a push-up plus. You're going to keep your elbows straight, okay? You don't want to bend your elbows like a regular push-up. This is a different kind of push-up. And what you're going to do is you're going to protract those shoulders, okay? And then nice and relax, okay? Now the inclination is that you're going to want to bend your elbows, but I want you to fight against it. You're going to keep those elbows straight. So you're going to protract those shoulders and then relax, okay? And you would do about 10 of these. So protract those shoulders. You can pause that, hold it in that position for about 5 seconds, and then relax. Now when you're coming down, like I said, you're going to want to bend those elbows, but I urge you to fight against it and keep those elbows straight. So all the motions in your shoulder blades. Okay. The next exercise I'm going to show you is called a wall slide. This is an awesome exercise. This is probably the most important exercise out of all of them. If you do this every day, this is going to definitely help prevent you from getting poor posture. So what you're going to do is you're going to come up against the wall. You want to try to get as much surface area of the back of your body to contact the wall. So you want to get the back of your heels to contact the wall, your butt, the back of your shoulders, and your head. And what you're going to do is you're going to raise those arms up as high as you can until you feel stretched, and then you come back down. So you want to keep the back of your hands, the back of your forearms, as much surface area of the back of your body to contact the wall. You come up, and then you come back down, okay? Now some of you may have a really hard time with getting your head to contact the back of the wall. So then for you guys, what I would recommend is you get a pillow, okay? You can place the pillow right behind your head and shoulders and do the same thing so that your head is supported. Another variation of that exercise, if you have trouble getting your arms like that, if that hurts your shoulders, you can keep your arms straight, okay, and do the same thing. it'll be a little bit easier on your shoulders. And that's fine, that's just fine too. This is still a very, very effective and great exercise for you guys. Now this is one that you may need to build up. Initially you may only be able to do a couple, but then eventually I want you to build up to 10 or more repetitions, okay? This is a really great exercise to stretch everything that gets tight from that poor posture, from being in front of your computer, and it's going to strengthen all those muscles that get weak, okay? The last exercise I'm going to show you, this is a bonus, is with a foam roll. So if you guys have one of these, this is a great tool for your posture. This foam roll is about 3 feet long and it's got about a 6-inch diameter. So what you would do is you would lay that down on the floor. And what you would do is you get your butt on the very bottom of the foam roll and then your head at the top. And you would do this on the floor. And then all you do is you bring your arms back and you hold this position and just relax. Hold this for about 5 minutes. And you can just relax into it. So focus on your breathing. You take a deep breath in. And then you breathe out nice and slow through your mouth. And then as you breathe out, try to really relax those muscles. This is a great one for stretching your chest muscles and for bringing your head and shoulders aligned with each other again. Now with this, what you may start to feel tingling in your hands, okay? And that's normal, okay? Because you gotta remember, you're stretching out those nerves, okay? You're stretching out the brachial plexus with this exercise. So to get that paresthesia or that tingling in your hands is normal. Once you bring your arms back over onto your chest again, that should go away within 5 or 10 seconds, okay? Okay guys, so that's going to be it. That's the last exercise. I hope this is going to really help you guys. Please, if you have any questions, leave your comments on your Facebook or Instagram page under this video, and we'll respond to you guys really quick. If you get any pain with any of these exercises, or if you're confused on how you do it, we recommend that you don't do that, okay? Come see us in physical therapy or come see your orthopedic specialist, all right? All right, guys, I look forward to posting a video for you guys next week. Have a great rest of your week. Bye, guys.